name is Dr. Adewale O. I'm an orthopedic spine surgeon in San Antonio. I got interested in orthopedics after getting into medical school when I did the rotation. I think like most people, my interest in it was just how big of an impact it could make in people's lives. With orthopedic procedures, some of the benefits more immediate than you see with other fields of medicine. That was really what drew me to it. It's also challenging, it's fun. Being a surgeon, you get a chance to be creative in ways that I think you don't necessarily get to be if you don't do something that's necessarily surgical. I got interested in spine surgery after I started orthopedic residency through the influence of several of my mentors and just from several influential patient experiences that I got to be involved with where I trained. I was just absolutely blown away by the type of change that we could make in people's lives when we do the job well.
And how long does it take to become a orthopedic surgeon and also a orthopedic spine surgeon? How many years of training?
It takes a long time to train to be a surgeon in any field. For orthopedic residency, it's about 5 years long. Most people these days will also do a fellowship, to subspecialize in one of the fields of orthopedics. I did spine. It takes a year to do that. And so when you include the 6 years of post medical school training, 4 years of medical school, 4 years of undergrad, it ends up being about 14 years after high school before you can be an orthopedic spine surgeon.
Okay. And what is a typical day for you? Like start off at what time and kind of end at what time? How does a day usually go for you?
The days are very variable. You can basically break them down to operating days and non-operating days. On days when I don't have surgery, the way my schedule is, I don't usually have patients to see at the hospital, and so I don't have to be anywhere until I start my clinic, which starts at 8 o'clock. Usually leave the house around 7:30. Hopefully, be home by 6 or 6:30. Operative days are earlier. So the OR always starts at 7. It's usually a good idea to be at the hospital by 6:30 to get things going. So you leave the house around 6, and they can go as long as they need to, depending on what you're doing that day. Really hard to make any plans on to happen after your operative days, just because things can go any of a number of ways. And then the schedule can also be broken down into weeks when you're on call and weeks when you're not on call. What I've described as my weeks of not being on call. If I was on call, there's always a chance in the morning that you're trying to fit in a surgery before your clinic or after clinic, or you need to see a patient early in the morning or late in the evening, and then those days can be longer.
Okay. And what type of surgeries do you do as a spine surgeon?
Spine surgery, if you really think about it, spine surgery can only do a few things. We can take pressure off of neural elements, so the spinal cord or nerves. We can stabilize segments that are unstable, so we can do fusions and things. And then we can realign things that are out of line. We can do deformity surgeries. My practice is pretty diverse. I operate on people's necks, their mid-back and their low back. I do so for degenerative conditions, and for tumors, and for very rarely for trauma. People who have broken bones in their spine.
Okay. And if someone, what advice would you give to someone who's interested in the field of medicine? Like if someone is applying to med school, what kind of advice would you give them, or even residency?
I think the process of getting into medical school, getting into orthopedic residency it's an involved process. It changes. The details of how best to go about it change all the time and are sometimes unique to your own particular situation. I think seeking out resources like this YouTube channel are really great. Finding a mentor is important, or even multiple mentors. Over the course of my own personal journey, many people went out of their way to show me things and teach me things and point out things that I might not have found out on my own that were tremendously helpful, both for getting into medical school and for getting into residency. If you're in undergrad right now, you're thinking about a life in medicine, probably the single most important thing you can do is focus on your grades. I think one of the key pieces of bad advice people receive frequently is that it's vitally important to be involved in every single thing that exists if you're going to go to medical school. And it is important. It's important to be a well-rounded human being. But considering that the cutoff for most people is not extracurricular activities, but their just their GPA, more people would probably benefit from just focusing as hard as they can on their actual transcripts. The other thing I would say is that there are only a few objective criteria that many schools look at, and it's usually a worthwhile experience to start studying for the things that are going to be looked at in the future early, specifically the MCAT. That ends up being a barrier for very many people that I advise, and I think the best thing you can do is just start preparing for that test sooner rather than later, so that when the time comes to take it, you're not as intimidated by it as you otherwise might be. I very frequently see people who have all the talent in the world, all the skills, every bit as smart as the next person, and they either wait too long to prepare for the test, and the consequence of doing that is that they get anxious leading up to it, and then they underperform. Everything else is important too. Everything you'll hear from everybody also matters. It is good to be involved in community activities. It's important to demonstrate that you're a good member of society, and to actually be a good member of society and an upstanding moral citizen. But if those things come at the detriment of getting better grades, I think you harm yourself when it comes to admissions. Okay.
And 14 years of training, how much can you expect to make kind of starting off kind of general as a orthopedic spine surgeon once you're done with all your training?
The salary is very variable and depends on the situation that you're in when you start off. It's all over the road, and the details of the work experience really are very different person to person. If you have a job, usually jobs where you're providing medical service, are more lucrative than ones where your role is principally teaching or principally research, like at an academic institution. I think the median income for orthopedic surgeons that start off is somewhere around $300,000 right now in the country. But then there's tremendous range in that, and there's tremendous opportunities to do either better or worse than that, depending on the details of your job.
Okay. Any other advice you would have for those out there watching?
One piece of advice that I got throughout this entire course is to try to live a balanced life. That sounds cliched when you're going through it and you're stressed out about one thing or the other. But the older I get, the more important I realize that really is to make the best effort you can to find balance in your life.
Okay.
And medicine is awesome. I'm very, very grateful to have been a part of this field, and I thoroughly enjoy what I do for a living. But the rest of your life matters a lot as well, and you should spend some time with it.
If there's anyone out there that wants to contact you, or any patients that would like to be seen by you, how can they contact you? Or
you can look me up at the San Antonio Orthopaedic Group, www.tsaog.com, and is the group that I'm a part of, and easy to find on there.
Awesome. Thank you.